telling you, going into labor is nothing like the movies. Everything is a scam, and here's why.
Okay, go back and watch that video, but I'm going to try to sum up her story for you really quickly. She was talking about her delivery or labor process with the first child she had. I think it was her first child, but anyway, in 2022, she was pregnant. I'm guessing sometime after 37 weeks term, went in for an OB visit. They put her on the monitor. Not sure why they put her on the NST, but they did. They found that she was contracting every 7 to 8 minutes. They checked her cervix, and she was 4 centimeters dilated. She lives 45 minutes, I'm guessing, from the clinic where she went for a prenatal visit. Not sure how far away she lived from the hospital. The nurse goes and calls the hospital, probably to tell them, yo, we have a patient here who's term, 4 centimeters dilated, contracting every 7 to 8 minutes. And the nurse comes out and tells her, the patient, that the on-call labor and delivery doctor said he was not willing to accept her unless she was willing to get induced with Pitocin. And she's like, but I'm 4 centimeters dilated. Why would I need to be induced with Pitocin? Which is a legitimate question. What I think happened is this. I think they may have said induced, but either the doctor and or the nurse meant augmented. If someone's 4 centimeters dilated and they're contracting regularly and you give Pitocin, that's augmentation of labor. That's not inducing. Inducing means they're not contracting, they're not doing anything. They may be 4 centimeters and not in labor. There may be patients who are 4 centimeters dilated and not in labor. It's usually patients who've had children before. And you use Pitocin to induce, get labor started. But in her case, she was already contracting in 4 centimeters. So if you add a Pitocin on top of that, that's augmenting her labor, not inducing her. There's a difference. So you're right to question that. Inducing at 4 centimeters with someone already contracting is not the correct terminology. They should be saying augmenting with Pitocin. But even that, when you go to the hospital and you're already contracting regularly on your own and changing your cervix on your own, you don't need Pitocin. You don't need Pitocin for augmentation of labor. There are plenty of patients who come in and are contracting regularly and changing their cervix. They don't need Pitocin. So I think the thing to do is this. If I was anybody who's not in medicine going into labor, if they want to start Pitocin on you, ask why. Why do I need it? What's the indication for the Pitocin? Pitocin can be used for one of two reasons. Number one, you come in for induction of labor and your cervix is already favorable and you don't need a cervical ripening agent, and so they just go straight to Pitocin. That is a Pitocin induction of labor. Number two, you're laboring and you're not changing your cervix appropriately in a timely fashion. You may have stalled out, and they say, we would like to, which is what they should say, we would like to start Pitocin to augment your labor, meaning get the contractions going in a more regular pattern. They should always ask you first. But another thing is, if the doctor actually said he would not accept her unless she was willing to accept Pitocin, that's shitty. Can't believe a doctor would say that. I'm sure they do. I believe that they probably do, but they should never say that. And if that was what anyone's being told, is you can't come to labor and delivery, they won't accept you on labor and delivery unless you agree to take Pitocin, you need to let somebody know that was said to you. So, did you get Pitocin either for induction of labor or augmentation of labor? And was it explained to you why?